أهلا بيكم. Today we are going to study the submandibular region, which is the digastric triangle. Let's go. First of all, the boundaries. It's bounded in front by the anterior belly of digastric, and in the back, posterior belly of digastric with the stylohyoid muscle on it. And the superior border is the inferior border of the mandible, and you can go with it till it's with the trajectory to the mastoid process. So it's all this area is the digastric triangle. Remember this because we have a parotid gland here. We always skip that from the submandibular region. Okay, its roof is covered by skin, fascia, platysma, branches from the transverse cervical nerves and the cervical branch of facial nerve. This is very important. Tributaries to the facial vein, all this in the roof. And the floor is formed by the mylohyoid muscle and posteriorly by the hypoglossal muscle. Keep in mind that the mylohyoid covers the anterior part of the hypoglossal muscle. This is the floor of the triangle. The anterior part contains the submandibular triangle, submental nerve and vessels, and nerve to mylohyoid. The submandibular lymph nodes also exist there, and the posterior region contains the lower part of the parotid gland. Remember this, please. Don't forget that. So actually the digastric triangle has two glands in it. The lower part of the parotid separated by the stylomandibular ligament from the submandibular salivary gland. Okay? Okay. Now the external carotid artery is deep to the stylohyoid muscle, so deep to the gland, as well as the internal carotid artery with the internal jugular vein and the vagus nerve in between, are deeper structures to the triangle, and the structures passing between the internal carotid and external carotid, as you know now, it's the styloglossus, stylopharyngeus, and glossopharyngeal nerve. We forgot the pharyngeal branch of vagus as well. Now, in this region, when you want to operate, please, the incision should be lower down from the edge of the mandible. Why? Because you will cut the cervical branch of the facial. The cervical branch of the facial is given and runs parallel to the inferior border of the mandible to supply the platysma. So if you operate on this region and you made an incision high up, you will cut this nerve, so you will paralyze the platysma on that side. This to keep in mind. Okay, overview of the salivary glands. There are three pairs of major salivary glands, as you know, the parotids, the submandibular, and sublingual, and there are approximately 600 to 1,000 minor glands in the mucosa of the oral cavity and the pharynx, the oropharynx. The major one the major ones are the submandibular, the sublingual, and the parotid, as we said. Parotid is the largest. It takes about 50% of the total saliva volume. Now, salivary glands are divided or classified according to their secretory units. I mean, some glands secrete more serous fluid than the mucus, and some glands produce more mucus than serous, and some glands almost both are equal. The parotid gland has more serous component, and the serous component is responsible for the watery secretion and the rich enzyme contents. It's serous rich in ribosomes. Staining under the microscope. So the serous part, which is the parotid gland as an example, secretes watery secretion, while the sublingual gland is has an abundance of mucus units. They secrete the most mucus secretion of saliva, and the submandibular lies somewhere in between. As you will see in these histology pictures, look at that. Here are a couple of ducts, or a duct is cut. This is a glandular tissue. This is a glandular tissue, and this is a glandular tissue. Look at this. It's almost all the same color. Dark, very few light colors. Here you have lots of dark and lots of light. Actually, the light colors are the mucus component, and the dark colors are the serous component. This is a submandibular gland specimen. This is a parotid specimen. And look at this one now. This is full of mucus components. See that? It's definitely the sublingual salivary gland. So this is sublingual. This is parotid because of the serous abundance of serous component, and the mixed type where you cannot tell whether this is mucus or this is serous. Our gland today is a mixed gland, the submandibular gland. Now, of course, you know, the paramyxovirus, the mumps virus, affects the gland. Sometimes swelling of the gland is only one. Swelling involves one gland if it's with fever. So this may be a case of acute inflammation, sialoadenitis, or sialolithiasis, which is stone in the duct. Lithiasis is stone formation. Another example of a disease that hits this gland is Sjogren's syndrome. Sjogren's syndrome is an autoimmune disease in which there are some diseases in which the body forms antibodies against self. Of course, this is a very bad situation. One of them is the Sjogren's syndrome, where it attacks the salivary glands and lacrimal glands, leading to xerostomia, stomia, mouth, phlegm, xerostomia, xerogaph, dry mouth, xerostomia, and xerophthalmia, dry eye. Sjogren's syndrome doesn't come alone. It comes with other autoimmune diseases like the systemic lupus erythematosus and the rheumatoid arthritis. That was only an example. Now, for the submandibular gland, it's a major tubuloacinar gland. It has tubules and acini, size of a walnut. It has a superficial and deep parts. Now, these parts are connected behind the free border of mylohyoid muscle. The one you see here is the superficial lobe. It's connected to the deep lobe after curving around the posterior free border of mylohyoid muscle. Do not forget this fact. Let's get to the superficial lobe. The superficial lobe has lateral surface. By the way, all this is the superficial lobe. Has lateral surface that faces the mandible, actually. Medial surface faces the inside. And an inferior surface, the one you see here, which is subcutaneous. I mean right beneath the muscles and face muscle and fascia, the platysma and fascia, the inferior surface. Extends anteriorly from the anterior belly of digastric and posteriorly till the stylomandibular ligament, where it's separated from the lower part of the parotid gland. Above, it's medial to the body of mandible. It makes an impression on the medial side of the body of mandible called the submandibular triangle, and backwards till the origin of the medial pterygoid. Now, at the angle of mandible from the inside, there is a muscle originating there from a very rough surface called the medial pterygoid. So actually the lateral the gland occupies this area medial to the body of the mandible. Below it overlaps the tendon of digastric and stylohyoid insertion deep to it. Okay, this is another specimen. Beautiful dissection of the gland. See that? See the facial artery? Facial artery, it was deep, then becomes superficial to it on its face to the on its way to the face. This is the anterior belly of digastric, and this is the mylohyoid muscle to show here. Now I wanted to show you the submandibular triangle, submandibular fossa, I mean, or impression. This one. See, behind it is the rough area for the origin of the medial pterygoid. That's why the gland is related to this side of the mandible and the origin of medial pterygoid, lateral to it, lateral to the lateral surface. This is another depression called the sublingual depression or fossa, and of course, logical, it's filled up with the sublingual gland. This is the medial surface of the body of the mandible. The lateral surface, we said, in the mandibular fossa and the origin of the medial pterygoid. The facial artery, on its way upwards, it grooves the posterior surface of the gland and the upper surface, and then descends on the lateral surface, then curves around the mandible and goes up. Why did it go this course, have this course? It wants to go deeper, to be at the side of the oropharynx, to give its ascending palatine and tonsillar branches. That's why it went deep, so it became, it grooved the posterior part of the gland. And then after giving the branches, it wants to go out again, so it has to come at superficial to the lateral surface of the gland for a while, and then curves upwards on its way to the face. The facial vein is superficial all over the gland and taking its tributaries. So the artery was deep and then became superficial, and the vein is superficial. The inferior surface of the gland is covered by, as we said, the skin, fascia, platysma, transverse cervical nerve, cervical branch of the facial nerve, tributaries of the facial vein. Okay? And careful in incision. Now the medial surface of the gland, medial surface, either here or backwards. We said it curves around. This is a coronal section. I mean, looking from the front with a coronal section. This is the medial. This is the superficial lobe. This is the deep lobe. This is the mylohyoid muscle. So as we go back, this is the hyoid. As we go back, this will end, and the hypoglossal alone will be there, because only the anterior part is covered by the mylohyoid. Now what do we see here? Superficial to the gland, we said it before, the skin, fascia, platysma, and etc. And deep to its superficial lobe is the artery, then becoming superficial again and on its way to the face. Now deep medial surface of the gland, posteriorly, now at back, we're to go more backwards than this level. Posteriorly, it's related to the styloglossus, stylohyoid ligament, and the glossopharyngeal nerve, separating it directly from the pharynx. As you come forwards to come to this level, this is the intermediate portion. An intermediate portion related to hypoglossal. Remember, the hypoglossal had a part that is not covered by mylohyoid. Hypoglossal, and of course this is the medial surface and the deep part, and separated from the hypoglossal by the styloglossus muscle, lingual nerve, hanging from it the submandibular ganglion, and below it is the hypoglossal nerve, this one, with its venae comitatus, or the deep lingual vein. This is the order from above downwards. See, the lingual nerve, and below it should be the submandibular ganglion, then the hypoglossal nerve with its venae comitatus or the deep lingual vein. Now, the lingual nerve curves from lateral to medial around the inferior surface of the submandibular duct. The duct, you will see it at deeper levels. You never see it at superficial side. You see it in the deep side because it emerges from the deep part of the gland and goes forward. Okay? So remember this. The duct, the lingual nerve, the ganglia, the hypoglossal nerve with its venae comitatus or deep lingual vein. Okay? From the anterior part, as you go forward, more forward towards you, towards the watcher, now the mylohyoid takes over. So what's between the gland and the mylohyoid, more front section, will be the nerve to mylohyoid with the its submental vessel, nerve and vessels to mylohyoid with the submental nerve and vessels. That's it. So anteriorly, the mylohyoid with structure on top. Posteriorly, we have the styloglossus, stylohyoid ligament, and glossopharyngeal nerve. And in the middle, you have all the stuff about the duct, the lingual nerve, the submandibular ganglion, the hypoglossal nerve with its venae comitatus or deep vein. Are you oriented now? This is actually rather in the middle going backwards. Okay? Please concentrate because this is a very rich area for multiple choice questions. They play you as long as they want. You know, for example, here, look at these. These are the lingual vessels, not the nerve. The nerve is lateral to the hyoglossus, while the vessels are medial to hyoglossus. Remember this, okay? Okay. This is another beautiful specimen. This shows the lingual nerve, lingual artery, lingual vessel. See that? And this is the hypoglossal nerve. And this is the hyoglossus muscle. We are superficial to hyoglossus because this is the lingual nerve and this is the hypoglossal nerve. Okay, again, for the deep lobe between the hyoglossus medially and styloglossus, inserting in the hyoglossus, and the mylohyoid infralaterally. Now the lingual nerve comes out, is superior, then the submandibular ganglia, then the hypoglossal nerve, then the deep lingual vein. Okay, the blood supply of the gland, what do you expect? It comes from the mainly, of course, from the facial artery, which has direct relation to the gland, and the lingual artery as well. Lymph drainage to the deep cervical lymph nodes, and nerve supply. Well, for glands, nerves come either directly or with the plexus around the vessels. This gland receives direct secretomotor branches that stimulates secretion. Of course, it's parasympathetic and from the submandibular ganglion, and receives vasomotor, that's sympathetic plexus around the facial and lingual, derived from the superior cervical sympathetic ganglia. Remember that? The great rami communicantis it gives to the nerves, and the plexus it forms around the vessels. This is the continuation of the plexus around the external carotid artery. Part of it is the plexus around the facial artery. It delivers vasomotor. Yes, it affects the vessels there, and then the blood supply stimulates secretion in this case, not direct stimulation by neurogenic impulses. Okay? The ganglion, it's a parasympathetic ganglia, and there's a trend that parasympathetic ganglia always near the organ they supply. contrary to the sympathetic ganglia at the sides of the CNS, away from the organs they supply. Now see that? This is the submandibular ganglion. See how it's connected by filaments to this nerve. This is the lingual nerve, and filaments to the gland. Now, what's the story about this? Now, the secretomotor fibers, the parasympathetic fibers, actually the cell bodies were in the superior salivatory nucleus in the brainstem. And this gives the facial. And part of the facial fibers is called the chorda tympani. The chorda tympani carries impulses, part of which are parasympathetic to glands. It exits the skull through the petrotympanic fissure and joins the lingual. You see that? See this small branch here? See, it joins the lingual. This is the lingual. Now the fibers remain separate than the rest of the fibers of the lingual, but wrapped at the same nerve. Now the posterior filament you see is the chorda tympani actually going to the ganglia to a synapse there. And postganglionic fibers arise and make the rest of the filaments. See? Some of them go with the nerve to be distributed to their targets like the sublingual gland. Some of them go directly to the gland to supply. So the most posterior filament actually is the chorda tympani fibers going to make a synapse, and postganglionic fibers arising as these filaments, and these filaments going to with the lingual nerve to their final destination. You see that? This is how the gland is supplied. So it's supplied originally by the facial nerve. Okay? Chorda tympani branch. This is crucial. This is crucial information. Do not forget this. Okay, the submandibular duct, it forms extensive network of tubules inside and gathers to form a single tube from the superficial lobe that goes backwards and curves in the substance of the gland around the free posterior border of mylohyoid, then emerges from the deep surface. Now this curve around the mylohyoid is called the genu of the duct, rukba, knee of the duct, and goes to collect saliva from the deep lobe, and then emerges from mostly from its medial surface, and passes to the front and to the medial side, where it will be crossed by the lingual nerve. See that? This is the lingual nerve crossing it from lateral to medial at the site where the sublingual gland is. Do not forget this. The duct at first it was between the hypoglossal and mylohyoid, then between the sublingual gland and the genioglossus, which is the tongue. Genioglossus muscle is the tongue. And opens in the floor of the mouth at the summit of, you see the mucosal fold under your tongue when you raise your tongue in the mirror? The base of that fold, this is called the frenulum. At the base, if you wipe out with gauze, you can see the splashes of saliva coming out of the two openings of the two submandibular ducts. At the summit of the lingual papillae, it's called the lingual papillae, at the base of the frenulum. There is a technique to show to x-ray the glands. We inject a dye in the duct through its ostium, through its opening, and wait for a while, and then take an x-ray picture. This is called a cyanogram. If you want to view the duct system of a gland, this is called a cyanogram. Cyanolithiasis, we mentioned it before, it's stone formation. And the submandibular is, they say, because some books you'll read that because the duct takes this curved turn backwards, so it produces a case of stasis in the saliva, which make it more susceptible to lithiasis, to stone formation. But this is a theory, it's not proven. Now, last but not least, the submental triangle between the two anterior bellies of digastric. This is the submental triangle, floored, of course, by the mylohyoid muscles meeting in the midline raphe. It has the terminal branches of the submental vessels and nerve, and the beginning of the anterior jugular veins. That's it for the submental triangle. I think this is the end of this lecture. Next time it will be pharynx, I think, if you want to read a little. Thank you for watching.